Hi, my name is Sheetal Chhabra, and I'm the co-program director of the Diagnostic Medical Sonography program at AIMS Education. And my role here is to ensure that each graduate that enters the workforce as a sonographer has the knowledge, training to be in the healthcare field. Ultrasound is a modality that uses sound waves to obtain images of the body. And diagnostic medical sonography is an important field. Obtain those images which are going to help the radiologist do several diagnoses. It's not only limited to abdomen, OBGYN, and vascular, but a role of sonography is also in various invasive procedures such as paracentesis, thoracentesis, and any kind of biopsies. Biopsies are done through, these are all ultrasound guided procedures, and our sonographers are assisting surgeons and radiologists in these interventional procedures too. The expectations from the program applicants is that they should have great interpersonal skills, they should have leadership qualities, be very compassionate, and very motivated to be successful in the healthcare field. So the curriculum of DMS is a 6-semester program. It's a 2-year in length, and it is divided into didactic, lab, and the clinical components. The students begin with the general ed courses, then go to the major diagnostic courses, and finally the most important portion is the clinical internship, which is the area where they will be placed in the clinical sites, gain hands-on experience to be ready to work in the field. We prepare our students not only in affective, psychomotor, but also with the cognitive skills. Affective skills are patient care skills, the communication skills with an attention to detail for each scan that they're going to be performing in the field. The psychomotor skills are real, actual hand-on skills on how to obtain those diagnostic images, which the radiologist is going to be reading. And of course, the cognitive skills is applying knowledge to those images and helping the radiologist come up to a diagnosis. One of our major aspects of our being strong program is our clinical affiliates. We have affiliations with major hospitals and imaging centers in the tri-state area. The certification exams that are required to find a job as a sonographer are the SPI, which is a sonographic principles and instrumentation, which is a physics exam. And apart from that, the students must take a ARDMS exam, which can be either an abdomen, OBGYN, or a vascular. We are a KHEP accredited program, so our students can take those exams, the abdomen and OBGYN, 60 days prior to the graduation. Apart from the strong didactic foundations that we provide to our students, we have multiple review classes. We have mock exams where the students can sit and take those exams to see how they are prepared. But the review classes, which are conducted once every month, when the students are in the clinical internship, help them prepare for these exams. We would encourage students to come in and visit our campus, and we can provide you all the information and you can have a tour of the facility.